Hi, my name is Lee Acey. I'm the administrator of a brand new clinic in Austin, Minnesota called HELPcare Clinic. And in this video, we're going to discuss some of the problems in the U.S. healthcare system today. As we talk to community members in Austin, Minnesota and beyond, the major problems they see with U.S. healthcare is that it's unaffordable, that it's impersonal, and third, that it's ineffective. I would encourage you to check out this book called The Price We Pay by Dr. Marty Makary. It's a great profile of what's going on in the U.S. healthcare system and how it has gotten so out of whack. Probably the least controversial assertion of these is the unaffordability of healthcare. And just to illustrate it, this is an actual lab bill from my wife, Lisa, from about a year and a half ago. And the out-of-pocket cost for a blood draw plus 3 blood tests was $504. And this was even with Mayo Clinic employee insurance. For 2022, the Medica Mayo Select family insurance is $2,086 per month. For Mayo Medica Premier, it's almost $27,000 a year. And it'd be one thing if you paid $27,000 and then you didn't have any more medical bills for the rest of the year. But instead, there are deductibles and copays that frankly can have a major impact on the family budget. Secondly, most people would agree that U.S. healthcare is becoming impersonal too. It's becoming a much bigger business. People aren't able to talk to their doctor directly as they formerly did, and instead they're going through nurse lines and chatbots, and there are all these barriers in between people being able to have a conversation with their healthcare provider. And finally, U.S. healthcare is ineffective. We have the most expensive healthcare system in the world with great high-tech equipment. But if you're going to look at the effectiveness of a healthcare system, one thing you'd look at is how long are people living and how healthy are they? This is an article from 2020 that talks about how from 2016 to 2019, for the first time in several decades, U.S. life expectancy had decreased. And then it got even worse in 2020 as life expectancy declined by a full year and a half. This map does a good job of capturing some trends that really exemplify how the system has been failing the American population. In 1990, there was no state that had an obesity prevalence of more than 15%. So how are we doing now? So this is from 2018. As you can see here, there's no state that has an obesity rate of less than 20%. So in just a generation, we went from no state with more than 15% obesity to no state with less than 20% obesity. It's the symptom of a system that's failing. Closely related to this is the skyrocketing of diabetes diagnoses, as in just over 60 years, the prevalence has increased by more than 800%. In the next video, I'll be describing how Dr. Dave Strobel and I have designed HELPcare and HELPcare Clinic from the ground up to address these problems with U.S. healthcare. But in the meantime, if you'd like to learn more, please go to helpcare.health/clinic. Send me an email, give us a call, or stop by to see us